welcome to this Berkshire Vaccine Collaborative panel in partnership with the Berkshire Eagle and Pittsfield Community Television. My name is Francesca Paris. I'm a staff reporter with the Eagle. The Berkshire Vaccine Collaborative is a collaboration among Berkshire Health Systems, community health programs, the Berkshire County Boards of Health Association, and boards of health across the county. We're speaking here just 2 days before Massachusetts reopens, more than 5 months into the vaccine rollout, and more than 14 months into the COVID-19 emergency here in Massachusetts and in the US. And I have 4 healthcare leaders in the county here to answer some questions about where we are and what happens next. Thank you all so much for joining us. We have Dr. James Lederer. He's Chief Medical Officer and Chief Quality Officer at Berkshire Health Systems. He's also an infectious disease specialist. Thanks for being here.
Oh, thank you.
We have Dr. Mark Pettus, Director of Population Health and Community Care at Berkshire Health Systems. Thanks for being here.
Pleasure, thank you.
Michelle Durr is the Director of WIC and Family Services with Community Health Programs, and she oversees the vaccine effort with the CHP Mobile Health Unit. That's the big orange bus. Michelle, welcome.
Thanks.
And finally, Heather Barbieri. She's the Director of Emergency Management at Fairview Hospital, and she's coordinated the Berkshire Vaccine Collaborative's clinic in South County in Great Barrington for many months now. Welcome, Heather. Thanks for being here.
Well, thanks for inviting me.
So, Dr. Lederer, I want to start with you to set the scene a little. Cases, hospitalizations, deaths falling across Massachusetts, in the Berkshires, vaccination rates going up. Where are we in the rollout right now?
Well, I think we're in a very good place. Nationally, 131 million people are fully vaccinated. Here in Berkshire County, that number is about 46% of all Berkshire County residents are fully vaccinated, with another almost up to 61% have had at least one vaccine. So I think that's the good news. The good news is that we're on our way, but we're not there yet. And I think anything we can do to push those rates even higher mean that we'll see even more protection, because if only half the county is vaccinated, unfortunately, half the county is unvaccinated. And so there's still a lot of people at risk.
Yeah, and I want to talk more about that in a second. Can you remind us, we're learning more and more about vaccines. They're effective in the real world, they're effective against variants, but just take us back. If I'm fully vaccinated with one of the 3 vaccines approved in the US, how protected am I?
You're very protected. So again, to use the national numbers, the CDC has been monitoring vaccination and the after effects of vaccination, both from side effects as well as the efficacy. And they just recently published their most recent update, a study, if you will, that shows that people who are fully vaccinated, only about 0.3 to 0.5% are going to have breakthrough episodes of infection. So that's an incredible vaccine response rate. And we know from the studies, where most of these studies were done in 20,000 to 30,000 to 40,000 participants in the study trials, that hospitalization and death for the 3 main vaccines available to us in the U.S. were nearly 100% effective in preventing those complications of death and of hospitalization.
Really, really good news. And with these increased levels of vaccination, Governor Baker has said here in Massachusetts that we'll roll back almost all of our COVID-19 regulations as of this Saturday. Can you explain what the guidelines are at this point, what people can do?
Well, as of Saturday, we will all be able to, unless the stores and venues so publish otherwise. If they want us to wear masks, that's the owner's right to do that. But basically, we'll have in the outdoor arena, in the streets, in the parks, in our venues, we can go unmasked if we're vaccinated. And in our indoor settings, we can go unmasked if we're vaccinated. The expectation would be, if you're not vaccinated, that you still follow the masking requirements.
What can I do? I mean, should I feel comfortable going to concerts, throwing indoor parties, doing the things I used to do before COVID? And for you or for anyone in this panel, are there situations where you'll consider still wearing a mask even after the mandate is gone, and if it's not required, given, as you say, that many people in this county are still unvaccinated and not protected?
Well, I mean, that's a great question. So personally, I will feel comfortable in most settings that I find myself. And I say that because I'm fully vaccinated. I trust the CDC in its 0.3 to 0.5%, of all patients who do have a breakthrough episode, which means over 99% don't and are fully vaccinated and protected. But for some of us, we have small children at home, or we have elderly parents who stay with us, or any number of issues. Our spouses may have significant medical illnesses, and maybe they have incomplete immune systems. And so we still need to be mindful that because half of the county is not vaccinated, that means half of the county can still contract and transmit COVID-19. And granted, while 0.3 to 0.5% is very low, it still means, though, potentially, that I could take that home to my loved one. And so in some cases, I might not choose to go unmasked. I might choose to wear a mask, knowing what the risks are for my family.
Mm-hmm. And speaking of kids, we know kids 12 to 15 can now get vaccinated with the Pfizer vaccine. Hopefully soon they'll be able to get the Moderna vaccine as well. There's good news there. Kids under 12, do we have any sense at this point of a timeline on when they'll be able to get vaccinated?
Well, both Moderna and Pfizer have ongoing clinical trials for children 6 months to 12 years. And they're at about 6 or 8 large pediatric centers across the country. There's not one really local here in the Massachusetts area. Those will probably be ongoing through at least 6 months worth of follow-up so that people can ascertain whether or not it's as effective as it is in adults. So I'm thinking that we might see an approval in late winter, early into the first quarter of next year.
Speaking of the unvaccinated, we're talking about some 40% of people in this county who have yet to receive even one shot. That number is going down every week, but of course we've seen demand start to go down. What is the plan at this point to reach that 40% of the county, and what is the goal?
Well, I would echo, first of all, some of Dr. Lederer's comments on what has been an extraordinary response to date. And I think as we attempt to continue to expand the coverage, a lot of that involves education. And I do think we have a tremendous commitment and obligation to be sure that those we serve have the most complete understanding of what the risks and benefits of these vaccines are. As Dr. Lederer stated, this has been, I think, an unprecedented effectiveness for vaccines compared to historical examples like influenza. And we have seen relatively low risks or complications as a consequence of the vaccine. So we know that many people are still afraid. Maybe their understanding isn't as complete as it could be. So education is a huge piece. I think a second piece to this, and I know Heather will have some comments, is over time, as we obtain more supply of vaccine and can simplify the processes whereby people can actually access a clinic, many now will be walk-in, no appointment necessary. The extent to which we can reduce or eliminate any obstacle to access is critical. We live in a county where many people are older and often secluded, and so the extent to which we can be bringing more vaccine to places, and this has been happening all along. These might be senior centers, these might be community homes, homes that have adults with intellectual disabilities. The extent to which we can continue to target those higher risk populations that are more isolated and not as able to access a clinic easily is an important priority. And then I think as we gain more experience, this has very much been a learning experience for all of us. And I know we'll probably go here, but we are, in some instances of people who've acquired COVID, seeing very significant long-term effects. And so for many, perhaps as many as 30 to even 40%, this is largely data from University of Washington, that getting COVID is not necessarily one and done. Many people have very protracted symptoms. And I think the more awareness those who perhaps have declined the vaccination to date have with respect to the long-term potential consequences, that might shift the perception of benefit in a direction that we hope will embrace more people.
Well, I would love to talk about the 20 to 29 age bracket in particular, because this is the group with some of the lowest vaccination rates, except for, of course, young children. And, you know, many people in that age bracket, and I've heard them say this directly to me, you know, just aren't worried. They say it's not going to affect me the way it might affect my parent or my grandparent. But you, of course, at Berkshire Health Systems have seen middle-aged people, you've seen young people in the hospital, and of course, these lingering symptoms. What would you say, especially to people in their 20s, about getting vaccinated?
Yeah, so I think that the risk in general is lower when people are younger and when people are healthier. If you look at that 20 to 30 or that 18 to 30 age group, we know that within that age group, there are many young adults that have risks. They may be struggling with their weight. They may be smokers. They may be dealing with blood pressure issues. And so this is a demographic that, while the risk may be lower, is certainly not zero. The risks are still very prevalent. And Dr. Lederer and his colleagues have seen that, particularly as more of our older demographic have been vaccinated. We've seen more COVID with some acuity and even more protracted illness in that younger demographic. So again, I think part of the challenge is to address the perception that there's no risk at all. Then there's the social contract. We know that herd immunity, which we always talk about, and these thresholds of 70% to really establish more community-wide herd immunity. For the individual who's not yet been vaccinated, they can play an enormous stewardship role, even if they perceive that their own personal risk is not that great, in an effort to enhance herd immunity within the communities that they're in. And that's a very important reason to be thinking about getting that vaccination. And then lastly, I would say that the variants of COVID that we continue to hear about from, the UK, South America, these viruses are very intelligent, and they reinvent themselves in an effort to strategically target those individuals who maybe weren't initially as great a risk. And we have seen that with these variants. They do tend to be a bit more selective of younger ages, and you can get quite sick from them. So those are some of the things that I would be focusing on in an effort to better address that demographic.
Mm-hmm. Heather, I want to take a second and go to you. We're talking about getting vaccinated, and if somebody is watching this and they haven't gotten their shot yet, or their kid became eligible, or they have a neighbor who wants to get a shot, the mechanisms for actually delivering vaccines are changing around here. And I'd love for you to just tell us a little bit about the best way to get vaccinated if you wanted to do it today.
Sure. Today, the best way, and it's really been the best way for the past 5 months, but the best way to get information on where those shots are available is at getvaccinatedberkshires.org. That's our website that lists all the available clinics. There's a nice big green button, make an appointment now, for people that want to make an appointment. And there's the schedule up for those that prefer that walk-in option, which is totally fine with us. We're trying to make it as easy as we can for those that still need to be vaccinated, as convenient. So if you can pop in at 5 and you weren't able to make an appointment, we're still really happy to see you. So the 3 large clinics in the county will be shutting down operations shortly. We've just finished our last official first dose clinic. So we do have some clinics following up for the second doses in 3 and 4 weeks. And as that happens, we've already started the transition. So the vaccine is now available 7 days a week in North Adams and in Pittsfield at the COVID testing centers. So everyone's familiar with those. They're on the website in North Adams. It's at 98 Church Street, right next to the library, and in Pittsfield, 505 East Street in St. Luke's Square, right next to urgent care. Here in Great Barrington, we're going to We're going to have the clinics at WEB for a little bit longer. We're going to transition to our testing center, 475 Main Street. But again, the best place to look for those available times are on that getvaccinatedberkshires.org.
And Heather, what kinds of vaccines are you offering at these various clinics and testing centers?
Which is such a great question, because at the beginning, people came and you just got what we had, right? We would only have one type. We've been able to, the last few clinics, offer like all three types. So whatever people want is what we can offer. The type of vaccine available at each day at each site is also listed at Get Vaccinated Berkshires. So if people have a preference, they can look to be sure they're picking the right day and time.
Thanks. And Michelle, I want to turn to you now, because you are also working on this vaccine effort and playing a really critical role. I was lucky enough to get to go out with you in the mobile health unit and see your work, but some people who are watching may not know what you're doing. Could you just tell us a little bit about what the mobile health unit vaccine effort is?
Sure. So I'm with CHP, and so the mobile health unit we have is a collaboration with Berkshire Health Systems and CHP as well. And so what we're basically trying to do is to get into the communities, to find people where they're at and provide the vaccine. And we want to try to do this to all communities in Berkshire County. And so we'll go to the hill towns, we'll go into like Tyler Street in Pittsfield, or we'll work with other organizations, agencies. So we'll work with Bridge, VIM, the Christian Center, Warming, anywhere we can get into that has the trust of the community. And so the mobile health unit is staffed by a nurse practitioner, we have scribes, we have a coordinator. So we all go on, like you know, on the bus, we call it the big orange bus, Bob, and we go into these communities and we have a schedule. And what we're trying to do is build the trust, because it's so critically important. And before COVID, that's what we were doing. And we would go all over the county doing this, providing flu vaccine, all different kinds of assorted types of medical care. And when COVID hit, it was just so crucial. We felt so important to get into those communities that, for whatever reason, it's really hard for them to get to the big vaccine centers, and that could be transportation. Their lives are just so complicated, and it could be a variety of reasons. And so that's what we're trying to do with the mobile health unit. So we do have a schedule as well, and we're trying to get it out there, but it changes dramatically. I mean, it's like we may just end up at a gas station or somewhere else. So it's really where the crowds are, where people are, where we think outside the box.
When I was with you, you took your lunch break and you ended up vaccinating 10 people at a supermarket.
Right.
Yeah. And if I wanted to get a shot through the mobile health unit, where should I look for your schedule?
So ideally, you could call CHP, and on our website, on Facebook, we try to do it through the collaborative. If you're just looking for numbers, local community agencies also have it as well. We're trying to get it out there. Family Services is part of that. The WIC office is part of that as well. So we're just trying to, it's not an exact, because it changes so rapidly, but it's something.
And we've been talking about the 40% of people who aren't vaccinated, and that is a broad group, and there's people who have a lot of different, they may be completely against it, they may want to get it and not have gotten around to it, they may just need a little push. In your experience, talking to people, and when I was with you, I saw people who were hesitant and nervous up till the moment they got the shot. What have you seen as some of the reasons that people are hesitant? I mean, what's behind that, and what helps convince them?
Wow. Well, that's a loaded question. There are a lot of reasons why people don't want the vaccine. We've experienced everything from the chip in the vaccine. That's a common one that they hear. They get that from television or whatever, for just wanting more research on it, or just hesitancy in general, or who knows what. There's so many different reasons why. They're scared of getting a needle in their arm. They're scared of, there's trauma that they had in the past that they can't overcome. We've experienced that. Just more knowledge about it, more education. And so when we have on the mobile health unit, we offer Moderna and Johnson & Johnson. And so we give them the option of each one, and what, and talk to them about what one might fit into what they want to do or their lifestyle and try to guide them. There's a lot that really do not want it, and what we're just trying to do is build that trust, and so we listen to what their comments are. A lot of times when we're on the mobile health unit, we're in a street kind of situation, so there's other people there telling us, don't get that vaccine or get that or don't, so it's really hard, and what we're just doing is we put on a gentle approach and patience and listen to them. So that's kind of our tactic, and it seems to have worked. I mean, I can tell you, we went to, one time I keep talking about the gas station, we went to this gas station and ended up vaccinating their staff. All the staff hadn't had it for whatever reasons. And then that next day, the staff's parents came and got vaccinated because the staff person did. So again, like you said, it's just getting out there, getting them educated and saying, it's okay, you can do this, and providing it.
You mentioned, do you want to?
Well, I just think that's great. And you mentioned trust. And I think a challenge for all of us in the healthcare community is a recognition that there are many people that just in general are not trusting of the system. And so I think that trust capital, and we are in a community where we have a lot of direct outreach and connection. These are our communities, these are our homes, these are family, friends. And so I think that trust capital is really important. And sometimes you do just have to focus one person at a time and really personalize your approach to them.
Yeah. I want to circle back to a piece of what you were saying, which is the misinformation that exists around the vaccine. And you mentioned this sort of myth that there's a chip, that Bill Gates is going to track you. I actually heard one teenager who was getting vaccinated a week or two ago who said, well, if they want to track you, don't they just do it on your phone? But I do want to address one specific piece of misinformation that I've actually heard from people directly about infertility, this idea that the virus causes infertility. The CDC, of course, says there's no evidence of this. But could you just speak to that a little bit, Dr. Lederer?
Well, I think, as Dr. Pettus mentioned earlier, we have sources of truth, and then we have our friends and neighbors in social media. And it's difficult for any individual to really know what is truth. And so oftentimes they go to the wrong sources, or something becomes very flamboyant in the social media, and it's hard not to pay attention. And I think that's what we're facing today, is that there are many different feelings and philosophies that are out there, and that's where you have to do your due diligence as just a consumer of social media. It's one thing to just go to your Facebook friends and be re-engaged with what they're trying to say, and not to go to the CDC or to the Massachusetts.gov website to get truly informed information that you can use to help make decisions. Because I think that's where we are with this infertility. It is one of those things that got traction in the social media, and how do you prove a negative to someone unless we just educate, or unless I hold you accountable to go to the CDC, go to the mass.gov website, go to these different vetted websites that can give true, accurate medical information that you can trust, like Johns Hopkins or Mass General. And with that, you have to make your own informed decision. I think, as Dr. Pettus also pointed out, while we have the long hauler syndrome, and many people do suffer long-term effects, it's now been released in a study of over 200,000 people that 1/3 in the next 6 months after infection suffer from some kind of depressive anxiety or psychiatric illness. So, if I'm a 20 to 30-year-old and I'm worried about infertility because Facebook says for me to worry about that, versus this, the New England Journal of Medicine, which reports that 1/3 out of 200,000 people suffered definite, diagnosable, depression, anxiety, or psychiatric illness. I think I would want to be very careful that I am very informed and I know all the facts so that I can, I need to be concerned about the right set of facts.
Yeah. Dr. Pettus, have you, in your experience, have you heard stories about people? Can you say a little more about just the experience of what they've called colloquially long COVID?
Yes. And as Dr. Lederer just commented on, the research today would suggest that a pretty high percentage of those with COVID will have some lingering symptom. And these can be individuals that may have had COVID and very few symptoms associated with that initial infection, or these could be people who were quite sick and hospitalized. There's a sort of an indiscriminatory nature with which many people will have these lingering effects. And so there are several that I personally am following in our healthcare system. And many of these people were quite healthy before they acquired COVID. Many of them acquired COVID before a vaccine was available. And the most common feedback and sentiment that I hear expressed every time I see them is, oh, goodness, had I only received the vaccine before, I would have given anything in retrospect to have had that opportunity before this happened. But I would say ranging from fatigue, which is certainly one of the more common, residual effects, and this is fatigue that's disruptive. It's disrupting an individual's ability to maybe work as they would usually work, or manage their day-to-day lives as they would usually manage their day-to-day lives. But also including things like some shortness of breath that continues to persist, particularly with activity. Many people might have, we call it neuropathy. This is sort of irritability of the nerves that might affect the legs or the hands. We've seen this with other viruses like Epstein-Barr, which is the monovirus. We have seen longer-term effects often with Lyme disease. So there's a precedent for how some infections, and this is Dr. Lederer's area of expertise, but so a very high percentage of people are left with lingering effects. Now, the majority do seem to improve over time, but in my view, as we learn more about long hauler syndrome, it's another very compelling reason to be thinking about vaccination for those who have not yet been vaccinated, particularly if they're on the edge of the fence. I don't know of anyone who's experienced long hauler that would not have quickly rolled up their sleeve and received this series if that option would have been available to them. And some of these individuals that I'm following with long hauler syndrome were very much reticent about the vaccine. This is a 180 transformation. There's nothing like being ill and experiencing rather protracted symptoms that are disruptive to quality of life that will really change your perception. And if you feel well and you can't relate to that, well, it's going to be sort of hard to appreciate how bad that can be. So I think it's a really important issue.
Heather, I want to bring you back in here because you've been seeing people get vaccinated every week for the last 5 months. And I would just love to hear on sort of a personal level, like what you hear from them. I mean, what it means to them to get vaccinated, what they've been through the last 14 months. What's that like?
It's amazing. Absolutely amazing. We always talk about it at the clinics that it fills our heart, right? We feel so much better at the end of the day, even if we've had a 14-hour day putting on a long, busy clinic with 2,000 people. It is just so heartwarming. Last night, I mean, case in point, we're at the end of May. You would think that we would be done with that piece of it. Last night, I was with a young lady who got her vaccine, and she was almost in tears, just so relieved that things are getting back to normal. When you think about our community members that spent a year at home, a year without family, without friends, without grocery shopping, without church, without work, that we've given them hope when we give them that vaccine. And I will tell you that people are just as excited for their second dose as they are their first dose. We thought it would be great on the first and then old business on the second. Not the case. This young lady who now learned that where she's worked for years and unfortunately has been furloughed, where she used to work is going to open up again in August, and now she's got the vaccine, and it was just such an emotional time for her, and it was nice that the nurse and I got to share in that excitement.
That's great. I actually do want to ask you, Dr. Lederer, about second doses. If somebody missed their second dose appointment, if they didn't get it, should they still go get their shot? Is it going to be less effective?
Oh, absolutely. Get your second dose. There's guidance from the CDC that they'd like to have the second dose administered within the 6 weeks following the first, by that time frame. But if it's after 6 weeks, still get your second dose. And you don't have to start over. It's, you'll finish your series. And it's not unlike what we do expect to happen sometime in the future, which is it's likely we'll see booster doses start to show up. We don't know when. We don't know what the mix will be. We don't know if it'll address one strain or several of the circulating strains. But it's very, very likely that we will see booster doses coming. So this, it's going to be part of our normal community life, as it has been with influenza. But I think because we know that COVID is so much more impactful, with a death rate that's 20 or 30 times higher than influenza, this has to just be part of our normal thought process. And knowing that in the fall of a year, if it's time to get a booster, I'll go get a booster.
Right. In fact, in other countries, in Italy and Canada and other places, they've postponed the second shot by several months, and they're asking people to come in later. You mentioned the fall. At this point, summer is looking good. Last summer was relatively easy on our region, on our healthcare system. This summer, probably even better. We're vaccinated. We can go to events. The new normal, as they say. Are you worried at this point about the fall? Do you think we'll see restrictions again? Do you think we'll see more cases?
I think that really depends on these next few months. And also, too, I think for us in healthcare, Dr. Pettus and I are really interested to see what this holiday weekend and the relaxation of restrictions, what that foretells for 2 or 3 weeks from now. Will we see blips, or will we see, the good, kind of progressive decline as we've been seeing? Because in large part, that tells us what we can expect out of a 50% vaccinated population versus a 60 or a 70 or an 80. But my hope by the fall is that we will take our fully vaccinated from the 46% we are today up to the 60 and 70 and 80 with good education, with good information, with all the good work that both CHP and the clinics are doing, to bring people in. That gives me hope for the fall that with higher vaccination rates, we'll see lower community risk.
Do you expect the vaccine campaign to go through the summer?
I think as long as we have vaccine and people to vaccinate, we will see vaccination campaigns continue.
Mm-hmm. Mm-hmm. I want to ask you all what you would say if you were speaking with somebody who told you that they weren't vaccinated and that they didn't plan to be. And I say this having experience, having even neighbors who've told me this. Apart from just the facts, because obviously we've talked a lot about the facts, but it goes beyond that. How would you address somebody who didn't want to get vaccinated? What tools would you use?
That's a really great question, and one that in healthcare we struggle with at many levels, whether it's a vaccine or maybe acceptance of a blood pressure medication or a diabetes medication. And there certainly are those that may be at a point where there's no amount of education that will transform their perception of risk-benefit. That said, I do think that there may be personal reasons why somebody makes that choice, but the extent to which other individuals that person may love and care about could be impacted by that choice. In my personal example, my health has been pretty good. I'm at an age where I am at higher risk. I wasn't so much as worried about my health from COVID early on, but I have a son with Down syndrome, and he's got some health issues and very high risk. My primary motivation was more to protect him. I have a 95-year-old mother-in-law that I spend a fair amount of time with. My motivation was to protect her. And so I think this is a proposition that's much greater than just how I might personally feel about it. So I try to appeal to that broader sense of connection and value. And then I think today, I would not have had the knowledge to do this a year ago, and we've all learned so much. I certainly would point out to just how common, after acquiring COVID, these longer-term effects can be in place, and people who are unable to work, people who are unable to be as active as they would like to be. And again, I think that's just another piece of information that many today may not be aware of. And so those are probably the areas I would try to leverage. And to do it in a way that, we care about those we serve. This is not a mandate that we translate and say, roll up your sleeve. We love and care about the people we serve. And so our guidance is coming from the context of, we care about you, and we're doctors and caregivers, but we're also parents, we're spouses, we're community servants, and it's what stewardship is all about.
I think just to add the last piece to that, what Dr. Pettus says is absolutely spot on. And the one thing I hope that all of us as caregivers, and I know that Heather and all of those who are in the vaccination forefront do this, is just because you don't want it today, we will never close our doors to you. Right. We are always there for you. Your decision today is your decision today. And if you learn something, or if you get new information, or if you have a change of heart, or if you have something impactful in your life that makes you suddenly wake up and realize, I do need this, no doors ever closed to you from Berkshire Health System. I mean, we are here for the community and will continue to be here, as you said, until that vaccine campaign is over, and then it'll be a booster campaign. We'll be here for the community, and we want you to know that we will serve you. And we just want you to realize that it's your decision, but we're here to support as much as we can, and will always be.
So on one note, if I can add, we've actually, we've told people, we've encouraged them, make the appointment. Come if you're ready, and you can say no right until that moment when the nurse is ready to give the shot. But, if you're thinking that that's the right thing for you, make the appointment and come ask questions, right? Come and we've got the nurses who are there, very knowledgeable about the vaccine, and we can talk about the side effects and what's real. And you talked about myths. Some of those side effects are very much a myth. So we're happy to do that education, and you can make that appointment and you can change your mind at the very last minute. But what we found is once they make that appointment and come in, they're ready to hear some good answers and get those facts.
So for us on the mobile health unit, we vaccinate in the cars. So I think they're comfortable in there, or if they come on the street or wherever we see them. I think a nice tool to use is ask a lot of questions, and don't come in a judgmental fashion. Be open and find out where they're coming from and listen to them. And 9 times out of 10, you'll be able to connect with them on one of those reasons, or what's going on with them. And it may be something that's really quite simple of why they're not getting the vaccination. And so you can address that. But by just showing that you care and that you're open to hear what's going on with them and what's in their mind, then you can usually, talk to them about it and try to address some solutions. It may not be that time, but it might be down the road. And so I've always found that works, is just, ask a lot of questions.
I want to switch gears a little bit here. We've been very focused on COVID, but obviously we've also been affected as a community by other diseases and other public health issues. As we look at the end of sort of the acute COVID phase, as we look toward a new normal where COVID, of course, stays with us, but is less pressure on our healthcare system, takes up less of our attention, I would love to hear what you're thinking about now in terms of the healthcare landscape as you look at, we saw a record number of fatal opioid overdoses in the county, and very, very high numbers across the state and country. We've seen, anxiety and depression, people missing their cancer screenings. I mean, the list goes on. What are you, looking at and thinking about as we move into sort of a later COVID?
So I think you pointed out some of the things that are top of mind right now, which is all the care that's that's not been provided because people have been reluctant to expose themselves to the community. So we definitely want to pick back up and make sure that we bring people back along into a good glide path for managing their health care. The flip side of that for me, though, is all that we have learned. It's been incredible for us to watch our hospital numbers of admissions of pneumonia patients decline. Our hospital admissions for the numbers of people with chronic obstructive pulmonary disease decline. The admissions for the number of cases of congestive heart failure decline. I think in large part because we were masking. We were more social distancing. All those things that take a chronic disease and tip it over, an illness of any sort, they've all declined. Otitis media in little kids, that used to be what filled up a pediatrician's day. Those were definitely on the decline. And so I think for us, and certainly as Dr. Pettus can probably chime in, from a population health perspective and management, what do I advise my high-risk patients in October? Well, they're already going to get the booster. They've told me that. But what next? What should I do? And I think there's really some level of masking that probably is very important for certain high-risk populations to think about when the fall changes, the wintertime diseases would be expected to make a resurgence. And I think that's the exciting thing is we've proven that the simplest things work to take care of people.
Yeah, I would just add that the pandemic in general has unmasked this accentuated gap between the haves and the have-nots. And in Berkshire County, for example, about 12% of the countywide, was thought to be food insecure, which essentially means for the parent or that child, there's uncertainty as to whether they'll have enough food to get through the day or till the next paycheck. That number is probably as high as 18-20%. We're still learning and getting more public health data, but we're certainly seeing our most vulnerable population. And the Berkshires, I think, as we all know, is a less affluent demographic. We certainly struggle with a relatively high risk of depression and anxiety and PTSD, and as you pointed out, substance use, opiate, alcohol. So I think as a system, particularly with respect to population health and community care and community outreach, as we collaborate with our partners, CHP and the Brian Center and the many community-based organizations that we have in the Berkshires, there's a need to be tightening up even more the safety net and the community-based care and resources that these individuals are going to need now more than ever. And we're doing a lot to respond to that with food at home delivery, with medically tailored meals, free transportation and ride sharing, and demand for these services is going to be higher than ever. So we need to be prepared not just to hold those who've been putting off their care, but to really create resources and coordination of care for those who are at much greater risk from the perspective of social determinants of health.
Right, I'd like to jump in there because that's like my thing. Food insecurity, social determinants of health, and you're absolutely right, Dr. Pez. I just wanted to mention that there is a statistic for COVID vaccination within the Mass Health ACO population. And right now, and that's where we have work to do. And that's where we've always had work to do before COVID. And so really, it is so critical getting out there. As of, I believe, May 21st, 18.4% of Mass Health Fallon patients were vaccinated. And so that leaves a good majority of the population that we really need to focus on. And that's been the case. This is a hard population to reach out to because there's so many issues. And, that's that social vulnerability index. And so we have to find ways to get out to them. And it's just so great that that's what we're working on with the food insecurity, working with WIC. What we did with the WIC program was we offered the mobile health unit to the WIC participants in South County. So we had their own vaccination day. And so working with these organizations, and we'd like to do that with the North Berkshire WIC program. And so again, reaching out, finding creative ways where we can really work to increase the health and well-being of our community is so critically important. So I'm glad you brought that up.
Are you worried about, and any of you, Michelle especially, this vaccination gap, right, that's opening up between, we've seen that vaccination rates for Black and Latino residents are much lower than that for white residents, both in the county and across the country. We've also seen correlations in some states where richer counties are much more vaccinated than poorer counties. We've seen sort of political affiliations where counties that tend to vote Democratic are more vaccinated than counties that tend to vote Republican. I mean, there's a lot of different factors here, of course, but are you worried about the gaps getting wider as we open up with many people still unvaccinated?
I am concerned about that. I think we all are. And so it's just kind of figuring out creative ways to work past that. And how can we do it? And how can we get out there? And the mobile health unit is one source. There's going to be pop-up clinics. And this whole notion, I feel like, is of, well, let's not duplicate services. Well, we want to duplicate services with getting the vaccine out, right? Yes. We have to go. It's a big county. There's not a lot of us. We're rural. So we want to go to multiple places even over and over again to get that education out there, to offer the services. And if it's going out into the community, if it's going to food pantries, if it's going to the homeless shelters, if it's working like Cheshire, Windsor, Peru, all those isolated little towns, well, we have to get out there and do it. And so it's on us. And it's on us as a community to do that and get there. And so I'm hopeful that we will. And now that we have events opening up, like car shows and different things, we can bring it to them that way as well. So that's just another tool that we have available to us.
And I'm always so impressed and inspired by the ways in which our community rallies around need. And we're a market unlike Boston or Springfield or Albany. We're geographically defined. We have well-established health systems in our community. We have a good handle on our demographic. And so I think challenging though these issues are, it's easier for us to bring our leadership together, to try to acquire and attract resources, and then to develop community-based programs that, by their very nature, have to be high touch. These are not clinic visit typical encounters. This is meeting people where they're at, sometimes calling them 10 times a day. You may be rejected 9 out of 10 times, but it's the one where they open themselves to your care, where everything begins to shift. And that it has to be an unrelenting, ongoing effort to try to connect with those individuals. It's very challenging, but we have tremendous infrastructure that we continue to develop in an effort to improve that.
I was going to say, and I think, while we're concerned about that gap, Berkshire County is very fortunate in one aspect, and that is that Berkshire Health System and its community partners, CHP, the Breen Center, VIM, we are the only game in town. And as such, we have a unique opportunity because we have an integrated medical record so that we can reach out in a data mining capacity into our medical record, because we now have interfaced our medical record with the state's vaccination record. Mm. And so we know who's been vaccinated and who's not, and we can target those at-risk populations, or that those populations who may not have quite the social advantages of others, and we can pinpoint and focus on getting the vaccine out to them rather than making folks come into us. while we're making it as easy as possible with these walk-in clinics, we still have to know where to go. And so mining our data, understanding where our opportunities are, understanding where our patients are, and then reaching out 10 times a day to make a phone call to see if you can, get someone connected and make that appointment and come and get the vaccine.
And to give credit to the Berkshire Vaccine Collaborative, we know that you've essentially been a model for the state, that Governor Baker has cited the work here many times, especially early on. We had our infrastructure together here sort of before other parts of the state. Before we wrap up here, I would love to hear from each of you something that you're planning to do this summer that you maybe haven't been able to do in a while. One of the benefits of being vaccinated, something you said, I want to do that for ages. I'd love to hear what your plans are.
Well, I'll go. I am a Southerner. I was not far from the beach growing up. I miss the ocean. And not that the Cape is not a wonderful beach, but I'd actually like to be able to get in the water and have it feel warm. And so I'm heading down to Florida where my daughter lives, and we'll go to the Gulf Coast and play in the water and have a fun time.
I'm really looking forward to being with my extended family. I mean, to me, it's just been such a difficult year. Just in my own little family, my father's 91. He's finally vaccinated, fully vaccinated, so I can be with him. But even I have family out in San Diego. I have close relatives. Just to Memorial Day, we're all going to get together. We're all vaccinated. I'm so excited about that. It's not a lot of us. It's not our San Diego or our Chicago family, but it is our little New England family. And so just to have a barbecue outside, I think that's all I could take at the beginning because I've been so isolated with family and going. It'll have to be a gradual process for me, but I'm so looking forward to that.
It is the simple pleasures. And
yes.
I too miss the ocean. And each year, my family and I would go down to Yankee Stadium and watch a baseball game. And it became a family ritual. And so we've missed that the last couple of seasons. And so we're looking forward to doing that again. And I think for my son and so many in our community that are just anxious to get back to their bowling leagues and getting out, at the driving range and to do so with a bit more comfort and normalcy, I think is something we're all just, anxious to grasp.
So I'm a little different. I like the ocean's good, family is good. How I am planning on recovering this summer, I love in-person classes. I love learning. I have missed conferences. I have missed collaborating with my peers in emergency management. There's a huge number of disciplines that work together, and we haven't had the opportunity to do that. And today, Massachusetts Emergency Management set out a schedule for in-person classes in August, and that made me smile. I will be enjoying in-person learning.
Thank you all so much for your time today. I really, really appreciate it. And thank you all for watching. If you want more information on vaccinations, you can go to getvaccinatedberkshires.org. You can also go to mass.gov/COVID-vaccine. And of course, you can go to berkshireeagle.com and look at our coverage there. This has been a Berkshire Vaccine Collaborative panel hosted in partnership with the Berkshire Eagle and Pittsfield Community Television. My name is Francesca Paris. I'm a staff reporter with the Eagle, and today we had Dr. Jim Lederer with Berkshire Health Systems, Michelle Durr with Community Health Programs, Dr. Mark Pettus with Berkshire Health Systems, and Heather Barbieri at Fairview Hospital. Thank you all again for the time, and have a great afternoon.
Thank you.
Thank you.